I'll be talking about toxic work environment within the Kenyan context. A toxic workplace refers to a work environment that treats a person in a violent and cruel way with negative consequences to the employee's health and safety. That is by Rasul et al. 2021. Toxicity can involve behaviors such as aggressive or offensive leadership, threatening leadership or co-workers, bullying, harassment, and ostracism, all of which undermine a person's sense of safety. Unfortunately, however, very few employees report such toxic work behaviors. A toxic work environment contrasts with a collaborative environment that is friendly and supportive. A toxic workplace adversely affects both the mental and physical health of those affected. A study done by Crisan et al. 2026 found that a toxic workplace is linked to anxiety, depression, and burnout. Women reported having more frequent burnout than men, but overall psychological safety did not vary by gender. An article in the Daily Nation in Kenya by Mboro 2022 states that a toxic workplace can affect sleep patterns, lead to weight changes, increase medical problems, drug and substance abuse, lead to fatigue, paranoia, hypertension, and even a heart attack. Why does the discussion about workplace toxicity matter? In Africa and Kenya specifically, the rate of unemployment is high, especially among the youth. Kakina 2024 states that Kenya's unemployment rate was 39.1% in 2017, and that Africa's unemployment rate among the youth is expected to rise from 10.7% to 42% from 2020 to 2030. This means that leaving a toxic job may not be viable for many people. Also, organizations have power hierarchies that tend to prioritize authority over mental health well-being. Hierarchical cultures usually emphasize control, stability, and respect for authority, which can lead to employees fearing speaking up. This is by Lee and Lee 2024. Power dynamics also are affected by factors like gender, age, and social class. Attempts to speak up may be silenced by mental health associated stigma. In Kenya, stigma affects how people address mental health as it leads to social exclusion. This is by Doctors Without Borders 2022. Human resource systems also tend to lack neutrality. Hazel et al. 2025 states that HR bias is prevalent, something that leads to discrimination and unfair decisions. This might hinder some people from reporting negative work-related experiences. Who is usually affected by a toxic work environment? A toxic work environment can be based on age, sex, religion, race, ethnicity, among other things. Women may face gendered power dynamics when working with men. Ethnic minorities may face discrimination, and contract employees may be overworked due to lack of legal protection. Additionally, those young in their career may find it difficult to climb the corporate ladder. What questions do we therefore need to ask ourselves? First, is psychological distress related to toxic work environment an individual or a systemic problem? Krizan et al. 2026 states that a toxic work environment is usually a systemic problem. Another question is, are confrontation strategies effective, especially in hierarchical cultures in Africa? Confrontation may be viewed as insubordination or a sign of disrespect in the African culture. Culture affects how conflicts are resolved, and cultures with power distance focus on authority of superiors over their subordinates. Western assertiveness strategies may be viewed as challenging authority in the African setting. Another question is burnout a normal part of adult life, or is it a medical issue? While burnout is not classified as a medical condition, it is recognized by the ICD-11 as an occupational phenomenon characterized by exhaustion, cynicism, and declining professional efficacy. It is not a normal part of adult life. It results from chronic work-related stress. What position should we take as healthcare workers? First, do not tell the client to just leave their job. There are other factors to consider, like their economic situation. Take into consideration structural constraints and socio-economic status of the client's society. Job scarcity usually lowers a person's bargaining power and can lead to learned helplessness. Secondly, direct confrontation with work leadership may make things worse, especially in African culture, where there is a large power distance. Another thing is that you should not pathologize adaptive silence. Some employees in toxic work environments choose to remain silent or not speak up their concerns. Such silence is a strategy to protect oneself from demeaning or abusive behavior. Culture affects power structures, people's identity, and communication norms. Different and overlapping identities like gender, age, and ethnicity can make one vulnerable. In male dominated societies, women might find it difficult to be accepted and their words may be discounted. This can lead to self doubt and chronic vigilance. When it comes to intercultural communication in psychotherapy, we need to understand that in order to form a strong therapeutic relationship, the therapist client's communication needs to be congruent in matters to do with culture. Brooks et al. 2019 states that culturally sensitive communication helps to foster respect and understanding and increases patient satisfaction. The client may use indirect communication in therapy and avoid directly criticizing the work leaders. If the therapist misreads the client's communication, therapeutic alliance can rupture. In matters to do with assessment and diagnosis, it is important to contextualize assessment and diagnosis to reduce the risk of pathologizing adaptive responses. The practice of psychology is usually highly influenced by Western ideologies, yet there are huge cultural differences with Africa. In the setting of a toxic workplace, adaptive responses like hypervigilance should not be pathologized, for example, as anxiety disorder. Differentiate psychopathology from other things like burnout and moral injury. When assessing someone in a toxic workplace, take comprehensive history about power hierarchy and other dynamics like gender, screen for mental and physical symptoms, and remain sensitive when it comes to culture. In order to maintain a strong therapeutic alliance, ensure your communication is sensitive and validate the client's emotions, including the experience of systemic injustice. Do not impose Western models like direct confrontation without analysis of the risks involved. What are some of the intervention strategies that can be used? Interventions like group coaching, mindfulness, art therapy, social support, and engaging in stress relieving activities have been found to be useful in helping cope with the stress of a toxic work environment. However, such individual interventions usually do not address the root cause of a toxic work culture. Proactive steps like mentorship and issuing formal complaints have been reported to be less common, which points to loss of trust or access to institutional systems or a fear of reprisal. Toxic work environment is usually a systemic problem and therefore usually requires organizational interventions. Other personal interventions like cognitive interventions such as positivity and self-reflection, engaging in health promoting lifestyles like healthy eating, time management, and work life balance, and taking holidays are also effective. However, it is important for the therapist to teach the client to regulate their nervous system before engaging in cognitive activities. Additionally, psychoeducate the client on how to set boundaries strategically and help them map out their risks and plan on the way forward, whether they want to stay in the job, escalate the matter, or plan an exit strategy. In conclusion, workplace related toxicity is more than occupational stress. It is mediated culturally, reinforced structurally, and intersects with factors like class, socioeconomic status, ethnicity, and gender. The therapist should work on restoring the dignity of the client with the systems that are usually power constrained.